His chief complaint is his flat and broad nose. He had a history of trauma 4 years back.
Challenging reconstructive post-traumatic nose job right now. Patient met with an accident some years ago, has had some surgery elsewhere. A lot of scars running around his nose. And that's the treatment, reconstruction, rib harvesting, rib augmentation, septal reconstruction.
There's a deviation, it's a post-traumatic rhinoplasty. We can see there's a clear deviation, there's almost no nasal dorsum which is existing.
Hi everyone, here we have a patient over here. He is coming from Andhra Pradesh. His chief complaint is his flat and broad nose. He had a history of trauma 4 years back. So because of that he had this depression, this flat nose. Look at the side view. Very less projected dorsum, less projected tip. Overall a collapsed nose with broad alar base, and he doesn't have a breathing difficulty so far. So it's purely a cosmetic rhinoplasty. We are going to shift the patient. Look here. He has a scar over the dorsum of the nose also. The primary closure was done 4 years back when he had an accident. Quite challenging case with the possibility of harvesting rib also.
Challenging reconstructive post-traumatic nose job right now. Patient met with an accident some years ago, has had some surgery elsewhere. A lot of scars running around his nose, but we're going to augment the nose, try to give it a form. There's no tip support, so we're doing work on the septum too. Radix, dorsum. So you can see the before and the after right now. So he had a major accident several months ago, and this was in a different city, and this is all the scars from that. And he had issues with the medial canthus, and obviously there's no nose there. A lot of problems with the septum too, no support as well. And that's the treatment, reconstruction, rib harvesting, rib augmentation, septal reconstruction, spreader grafts, and also a lot of marginal rim grafts, alar patent grafts, and tip graft. Let me show you the side view. and you can see similar improvement here. This was almost 1-inch drop of a depression there, and we've brought it down to a few millimeters now, which is what it should be ideally. There was a lot of scar that had literally tethered onto the cranium, detached all of it via the nasal root, and then augmented and reconstructed the nose. And finally, we're going to show you the worm's eye view, where you'll appreciate that the width of the nose was 3 times that of the height, and this was essentially because there was no bony support and no septal support whatsoever. The alar cartilages were intact, so we used that to tip work after doing septal reconstruction. That's the immediate result.
Hello everyone, here we are post-operative, a little more than a week, almost 10 days over, for this very challenging post-traumatic rhinoplasty. I'll go on to explain as to how Dr. Richardson devised a treatment plan for him, but firstly we'll proceed with splint removal. A rib graft was needed for him because that was very much required considering it was post-traumatic. He had an accident about 4 years back, that's what he says, and also had a surgery prior to this. Okay, he does have a little bit of swelling and some incrustations that will clean it now. He had a lot of scarring before the surgery. Okay. It's because of the splint compressing the skin for so long. Okay, we'll give you a mirror such that even you can have a look. Fine, sir? The nose does look a little broad right now. That's because it's post-traumatic. This is all the swelling that will take time for it to settle. You can have a mirror. It's a bit heavy. Yes. So this is how was his pre-operative nose. There's a deviation, it's a post-traumatic rhinoplasty. We can see there's a clear deviation, there's almost no nasal dorsum which is existing. The tip and the alar base are the only things which can be appreciated. So it's been a reconstructive rhinoplasty, so as to say. You can see the side view as well. Okay, just turn one side. You can even appreciate this view. Dorsal augmentation has been done right from the radius till the tip. Yes, a lot of swelling does exist. It will take a lot of time for him to come down because it was extensive reconstruction. Rib graft had to be harvested for him. From all the views we can appreciate. We can even appreciate on the profile view on the right side. Just turn to your right, sir. Yes, when you can have a look. Right now, the dorsal height does exist, but the dorsal flare looks too much for you. It will come down. By dorsal flare, I mean this width does look too much. It looks excessive, it will come down. Okay, you can look up in the basal view if we can appreciate. There was only the tip that was visible from the basal view. You can have a look in the mirror right now. The dorsum does exist. It has been reconstructed. Doesn't look in the best of shape right now, but we are hopeful it will come down. The swelling will come down gradually, right? It's still all flaccid and smooth. because post-traumatic reconstructive rhinoplasty always takes that much of time. The good thing is his rib side has healed completely and the sutures are off. Medications have to be on for quite some time, sir, for you. Be in touch. Is there any pain right now that you're experiencing? No? He does have a problem of watery eyes or epiphora, and he did mention it, and Dr. Richardson had told him that this needs a 2-stage surgery. A rhinoplasty cannot be combined with a dacrocystorhinostomy, so both of them will be done in 2 separate phases. Sir, be in touch. Take the medications, send in your pictures. The swelling will take time. Come for review if possible. I know you stay far, but if possible, do come for review. Right? Okay. Thank you.